More now on the coronavirus crisis. I'm now joined by Nationals MP Dr David Gillespie. Dr Gillespie, thank you so much for your time.
Pleasure to be with you, Danica.
Firstly, in the last 10 minutes or so, the Australian Grand Prix has been cancelled amid fears over COVID-19, same with the ODI series. Is it time now that we consider banning a lot more on mass events?
Well, look, those very important questions are faced every day by the Health Policy Principal Committee. We have an established set of advisors, epidemiologists, the World Health experts that meet regularly, daily almost, about these very decisions. And we're guided by the Chief Medical Officer, Brendan Murphy, and through him, Minister Hunt. They're doing a fantastic job. Obviously, they've made the decision because some of the McLaren team were proven to be infected, and so a mass gathering like that, it was best to restrict people turning up in their hundreds of thousands.
You are the chair of the Coalition's Health Policy Committee. COVID-19 appears to be getting worse day by day. There's a lot of global uncertainty. Is Australia prepared?
Well, look, we're as prepared as anyone. In fact, we've been ahead of the curve compared to other nations, and in fact, ahead of the curve of the WHO. We recognised that this was a virus of potential pandemic proportions a month or more before. We actually declared it a fortnight ago, 2 weeks ahead of the WHO. And we have had preparations. We've limited travel from high incidence areas progressively. All of this is advised not by politicians, but as I said, we have some of the world's best epidemiologists and medical people working in the central control room in Canberra. The relevant Health Policy Committee meets regularly, and they make their decisions based on the best medical advice. So as the situation changes, more advice will roll out. Now, I don't want to second guess what the epidemiologists and the experts are saying. I used to practice medicine for 33 years, but now I'm a full-time poly, so I will be taking advice like everyone. The best thing people can do is apply common sense hygiene, wash your hands regularly. The virus is spread by droplets. So if someone coughed onto a desk or a table and you touch it, your hands can get infected. So wash your hands regularly. Avoid touching your mouth and eyes with your hands unless you've just washed them. And if you do cough or sneeze, cough into your elbow. And if you think you're sick with some flu-like illness, whether it's the flu or COVID-19, you should self-isolate and seek advice.
You do have a medical background, as you said, and from your own medical perspective, should Australia consider a Europe travel ban? Are we close to that stage at all, like what the US has done?
Well, I understand that's not on the agenda at the moment, but obviously if advice or the situation changes, that committee that I told you about, those experts, will make those sort of decisions. It won't be up to myself. It will be a considered decision which they go through every day about whether anything else needs to be done. But look, we've rolled out a package around aged care. We've got extra kit and infection control funding streaming down from the government. We've already put $500 million at the availability of the state health system because the hospitals have been doing a lot of the testing, but there's commercial testing available now through the regular laboratories. We've set up the method to get telehealth happening for consultations and triage. We're setting up or identifying places for these pop-up respiratory clinics so that anyone infected doesn't get mixed in with the general hospital population. And we have got things in place for remote area fly in, fly out workers, Indigenous settlements. Just about all the bases are covered, and extra stockpiles of protective equipment for the medical staff have been ordered. We already had a massive storehold of these, but we have covered all the bases. And as I said, we've been ahead of the curve in Australia, and that's why our expansion of the virus has been so muffled compared to other nations who are caught on the hop and have had it explode. Look, every virus in an epidemic will behave as viruses do, but that's why self-isolation is so important, and hygiene. The virus only keeps going when it's got somebody else to spread to. That's why self-isolation is important if you do have the symptoms until you get tested and confirmed, and also the hygiene matters, because if you don't spread it to somebody else or pick it up from somebody else, well, it runs out of places to go. That's the whole principle. But it is a virus and it will spread, so we're well prepared.
Just in regards to the government's stimulus package, we've just seen that the ASX 200 has plunged more than 5% this morning alone. Does it go far enough to quell investor panic at this time?
Well, look, we can't change stock market sentiments, which runs off more global issues about trade isolation and stopping tourism flow and all those things. But in terms of a target, the target in our country is keeping our domestic economy going. Small businesses are at the forefront of that, so it's a cash flow help. A reduction in cash flow is really difficult for small businesses to cope with. Families and pensioners and people on social security support are getting a cash injection, and so are we supporting apprentices who are obviously in small businesses. If someone hasn't got the money to pay wages, well, they look at the people that are maybe not critical to the business. So that's why we're supporting apprentices. We need more apprentices in this country, and the last thing we need is apprentices being laid off. So the subsidy is targeted, it's temporary, it's not ad infinitum. It'll go for 15 months. The rollout is going through existing systems, so we don't have to reinvent the wheel, but it will keep cash flow going, which is the lifeblood of our local economy.
Dr David Gillespie, appreciate your time. Thank you for joining me.
Thanks very much.